Hello, I'm Dr. Stanford Owen. I'm an internist. I'm also board certified in nutrition and psychopharmacology and a fellow in the Obesity Society. I've worked for 30 years in nutrition therapy and eventually developed the program that I use now called PrescriptFit Medical Nutrition Therapy. I think if you'll take the time to read material that we would be happy to send to you, you'll find that this program is very different from any other program that you've ever looked at or thought about. Now, most programs focus on weight loss. We don't. We focus on clinical outcomes. I developed this program primarily to treat type 2 diabetes and insulin resistance syndromes, and really all of the conditions directly related to nutrition. Hypertension, hyperlipidemia, sleep apnea, steatosis, fatty liver, and some of the adjunctive conditions that will respond to nutrition therapy: acid reflux, back and joint pain, heart failure. So the program is designed to measure clinical benefits, not just weight loss. Now, patients will lose plenty of weight, and they can lose large amounts of weight if that's their primary desire. It's been my experience, and in my own practice, most of our recurrent business is not from people who want to lose weight for some ill-defined, superficial reason. They want to feel better, and those patients who do feel better, when they relapse or stray from the program very far, will be back because they would rather feel better than worry so much about a particular weight. I'd say 85% of our chronic business is from patients who are repeat customers from wanting to feel better. Now, the program's different in that we have no foods that are excluded. We don't use portion control. We measure clinical outcomes. We do use a meal replacement product, and I will guarantee you that the meal replacement product we use tastes better than any other similar product on the market. I can promise you that. We have kids, especially 10, 11, 12-year-olds, who come in just to buy the product because it tastes so good. If they want it, I can promise you all of your patients will be happy with it. But more importantly, I designed this to alter cellular physiology to improve insulin resistance and improve metabolism. I put in it, it's roughly 50% egg protein and 50% calcium caseinate, and also included a specific ratio of single amino acids. The reason those are important is they require no digestion in the intestines. It requires no ATP to be absorbed. They directly enter the plasma, then require no energy or ATP to cross into the cell cytoplasm. Now, what that does is it allows the amino acid to enter the Krebs cycle and then alter sugar metabolism. This has an immediate impact on muscle function, and most of our patients notice brain function fatigue, sugar control, edema, dyspnea, all improve. You can make substantial revenue in your practice by incorporating this in your patient care, and as of September 23rd, 2010, it is mandated that healthcare insurance cover first dollar for dietetic counseling, diabetic treatment, nutrition counseling, and obesity treatment. First dollar means pre-copay, pre-coinsurance, pre-deductible. First dollar. You cannot afford not to have this in your practice. It gives you clinical outcomes, and we're soon to announce a data system that your patient will enter via their telephone that'll give your clinic outcomes on each of the medical conditions. You can contact me directly at Dr. Owen, MD, at drdiet.com, DROWEN, MD, at drdiet.com. Visit my website at drdiet.com, or call us directly at 888-460-6286.